Hello, today's topic is pilonidal sinus. What is pilonidal sinus? Pilonidal sinus is a small skin hole or a tunnel-like structure in the top, the cleft of the buttocks, top cleft of the buttocks. Usually, it happens in a male. Males are more common, and especially young adults are adult male is more common. The reason being they have excess hair growth. So how it happens is actually the hair which is growing from the skin outwards, it again bends back and grows inwards, piercing the skin again. This causes a foreign body like sense to the body, and the body reacts to the foreign body. So this hair, as it grows inside the skin back, it produces infection. This can lead to collection of fluid, pus, and this can give it pain. Sometimes abscess can form. Pus collection means abscess formation, and this leads to fever. So these are the symptoms. Symptoms are usually young adult male who has a hairy bottom, who has a job of long sitting hours. Usually the long sitting hours causes friction and heat production, leading to ingrowth of the hair, and this can lead to a small cyst-like structure where hair, fluid, debris, dirty things can collect, which can get infected. Once the infection comes, fever, pain, redness, all this can happen. And the treatment for this is, usually if it is very in the initial stage, a simple antibiotic can give some relief. But most of the time, when the cyst opens, the sinus forms. Sinus is a tract or an opening through which has internal communication. There will be a tract like this called pilonidal tract will be there. The diagnosis is mainly by the surgeons who is examining the patient with a history, and he may ask for a MRI. MRI is mainly to see the pilonidal tract, how long, how big, how depth is this branched, or there are multiple sinuses. All these things can be clearly give an idea with the MRI. The treatment options after the initially antibiotic, and most of the patients will require surgical treatment. And the big difference to any other surgery or any skin healing is, here the skin heals very slowly because for two reasons. One is because of frequent movement. The buttocks area, whether you are sitting, standing or walking, it will keep on moving. So the healing will be delayed. Two, there is not much of muscle, fat, so the skin is almost very close to the bone. So the healing, it doesn't have any fat cushion. So the healing also, because of that, the healing will be very delayed. And most of the time, it may require prolonged, wound care after the surgery. This pilonidal sinus is also called jeep driver's disease, because those days, especially the Second World War time, the drivers, were driving for a long time, for sitting posture, they cause this this disease. So this is called jeep driver's disease, and the surgeons will ask for a MRI to diagnose it. Not only that, sometimes we have to rule out any neurological congenital anomalies. So these are the things to look for before deciding the treatment for pilonidal sinus. Thank you.